I am the manager for critical care services, and along with Don Gleason, who's a process improvement coordinator in the emergency department, we'll be your session facilitators. Our guests today are Michelle Richardson from Clinical Informatics, Christy Scalzo from the Nursing Resource Team, and Kevin Halabecki, who's the clinical nurse specialist for critical care and neurosurgical services, and Dr. Rhonda Crocker-Ellicott, who is the president and CEO of Thunder Bay Regional Health Science Center, and then also the CEO of the Health Research Institute. So for our participants that are joining us today, at the end of the Q&A session, there'll be an open forum for questions. So as you're very familiar with, you can just send in your questions using the chat forum, and we'll make sure that your questions get answered. Before we get started with our session, I would like to introduce Matt Simeone, Chair of the Thunder Bay Regional Health Science Center Board of Directors, for opening remarks.
Thanks, Chad, and good morning, everyone. I just told the panel I apologize for my voice. I have bad allergies that are coming out, and I need my medication, so I'll be sure to do that soon. But thank you for inviting me here today. On behalf of the entire Board of Directors, I really am honored to be here today to celebrate Nursing Week. As you all know, we choose this time of year every year to celebrate the important contribution that the nurses and the support staff make in delivering quality healthcare and the well-being to our patients and their families. This has no doubt, I'm not telling anything you don't know, it's been a very difficult year personally, and I think for all of us, the pandemic has probably changed all of us somewhat. And the theme for this week's celebration, I'm told, is We Answer the Call. And today's discussion from Bedside to Boardroom has had an impact with me, no matter what role you serve. So whether you're a clinician, an educator, an administrator, a researcher, nurses throughout the organization, goes without saying, you've risen to the challenge to deliver safe, quality care. I was just off of a call. I'm in finance in my day job. I was speaking to someone in Alberta. I told him I had a hard stop at 11:15 because I needed to come speak to you. And he went like this. He said, "Tell them thank you," from the bottom of his heart. So I thought that was pretty impactful. You are our frontline response to this pandemic, and I can't thank you enough. I want to take this opportunity to thank all the nurses for your resilience, for sharing your expertise amongst each other, because that's important, makes us better, for contributing to the advancement of our research, and for educating our patients and our public, and genuinely caring each and every day. I echo my colleagues' comments that I just mentioned. So from the entire board, today and always, thank you. You make a difference, and you truly do answer the call. So thank you very much. Pat, over to you.
Tad, can I just say one thing?
Yeah.
Sorry, I don't know, Jay, if people are like emailing me and saying that they can't log on. Is there like something blocking?
No, everything that they should need was in that email. The password is Nursing Week if it's with no space, if they're being prompted for a password.
Okay, then I'll try to send that. Okay, sorry I just don't want. Okay, we can keep going.
Okay, thanks, Matt, for the kind words from yourself and on behalf of the board. So we're going to get started with our first little Q&A, and it's with Michelle Richardson from Clinical Informatics. So for those of you who are maybe unfamiliar with Clinical Informatics, informatics refers to the practice and science of integrating information and knowledge with technology to manage and integrate health information. So it's quite a difference from kind of a frontline or bedside nursing role. So welcome, Michelle, and thanks for taking time out of your day to join us today.
Thanks for having me.
All right, so Michelle, I'm going to start us off here and just ask you if you can tell us about how you first got involved in clinical informatics.
So I've been a nurse for the last 34 years, and 24 of those have been involved somehow with informatics. Ever since we've brought Meditech into the environment at Thunder Bay Regional, I've been involved either as a super user, or for the last 15 years, I've been a permanent member of the Information Systems Department. It was just something different. Like I said, I started as a super user, and it was something that seemed interesting at the time. And I guess I seemed to catch on quite quickly with the system. And I was asked then to start training other users, or other staff, sorry, to get them used to the system. I've worked on various projects over the years with physicians, with staff. And then in December of 2006, I moved permanently from the bedside into information systems or informatics. And it's just a completely different side of nursing. Like you sit in front of a computer all day instead of at a bedside.
Mm-hmm. That's great. So obviously, like you said, clinical informatics is very technical. So what type of training did you receive?
It was actually all hands-on within the department. I didn't go away from it for any kind of training. It was just I was taught by other users within our department for the systems. I work primarily with Meditech. I look after the order entry, the documentation modules. So it was all self-taught. As I said, coworkers. I have attended webinars with Meditech to upgrade, with any time there's new changes in the system, to learn, how to implement these. And then just also, I belong to a couple of different groups. One is ONIG, which is the Ontario Nursing Informatics Group. So it's a way to share information with other nurses in Ontario who are in the informatics field, to find out ways that they approach things. How are they training users? And I also belong to MUSE, which is the Medical Users Software Exchange, which is a North American group for all Meditech users. So again, ways to find out, what sites are using what features within Meditech and how they rolled these out.
That's great. So, Michelle, what about in your role, how does the clinical informatics specialist play a role in the interdisciplinary team?
We're not out there on the floors with the other team members, but really anything that a user does within the Meditech system is there because of us. We build the interventions that users document on. The orders that are placed within the system, we do those. So everything is there because of requests that have been submitted to our department to have these things built within the environment.
Good. So you talked about not just supporting, obviously, nursing, but there's other disciplines that your team supports?
Yeah. So with all users. So we're looking not just at nursing, but allied health, which are the OTs, the PTs, speech language, dietitians, also physicians. With them accessing the system, we create the user accounts. And if they need education, we do that. Radiology, all the diagnostic imaging, because we also have our PAC system. So the images are stored there. And it's not just here in Thunder Bay, but we have rolled out to all of Northwestern Ontario. So we're looking at the 12 facilities within Northwestern Ontario that we support and provide that support to, whether it be education or, contacting our service desk with a problem they have.
That's great. So obviously lots of support that your department provides. And then just lastly, what are the 3 biggest areas of time spent in the clinical informatics role?
For myself, probably the biggest is building, whether it be building new interventions for users to document on, building new procedures within the system, new orders that need to be there. So probably a good 50 to 60% of my day is spent with building. The other big one is user support. Folks contacting me, I'm having problems with this, or calls that are put into the service desk. Oh, I put an order in on a wrong patient, or I documented on a wrong patient. How do I fix this? So it's that user support. And then the third would be teaching. We provide education to nurses and clerks that are brand new to our Meditech system. But then anytime we're bringing a new area live, as I did recently with the cath lab, we would do education with those staff as well, whether it be, with documentation, placing orders. So we do all that training as well. As I said earlier, informatics is a really different field of nursing. I honestly didn't see myself going into this 34 years ago, but now that I'm doing it, it is really interesting. It is something completely different.
Okay, thanks so much, Michelle. I don't think people realize truly how much work goes behind the scenes with Meditech and the EMR and doing all of that. So it's good to kind of get that out there to show people that how hard you actually have to work to get things to work together. And it's not even just our hospital, it's across Northwestern Ontario. And happy Nurses Week, because you're still, when people think of nurses, they think of frontline. So we're trying to showcase other people. So we just wanted to say thank you for everything that you do.
Well, thanks.
So we're going to move on to Christy Scalzo. So she is now in a new role. She's a role of Nursing Resource Team Practice Coordinator. So welcome, Christy.
Thank you.
Is my thing, it's working, sorry, okay. So your first question we have for you, you recently made the transition from RN in ICU as well as charge nurse in ICU to a practice coordinator for the Nursing Resource Team. So how did your role in ICU help you transition into this new role and help you prepare for it?
Sure. As a bedside nurse for over 19 years, I've gained the knowledge and experience needed to become a mentor for other staff. I've challenged myself during my career as a critical care nurse by becoming a leader with MET and the RCCR team. Both of the positions have provided me an opportunity to support the staff throughout our hospital and the region. It has also allowed me to foster relationships with not only the frontline nurses, but with the leadership team and the physician groups in the hospital. As the charge nurse, I assist with supervising and coordinating the day-to-day management of the critical care department. This role has helped me develop leadership skills required in a fast-paced and dynamic environment. I'm expected to make decisions in real time and help support the staff, their needs, and assist the physicians with bed management issues. I'm there to provide professional and clinical consultation to nursing staff and daily planning and allocation of critical care resources. So in my current role as the NRT practice coordinator, I continue to use the leadership skills that I have learned in my previous roles. I continue to be a mentor and support the NRT staff throughout the facility by assisting them in developing their skills and practice.
Awesome. So tell us a little bit more about your role. Like what are the biggest things that you're doing? I guess right now spring hire is a crazy time for you guys.
Yes.
So tell us what all your job entails.
Yes, spring hire, we brought on over 90 staff. So every 2 weeks I've been pulling in 24 more staff and doing their orientation. So that has been keeping me very busy. But as the NRT practice coordinator, I'm responsible under the direction of the manager for working with program and service leadership teams to plan and coordinate the day-to-day activities related to quality and safety within the NRT. The role provides clinical and professional leadership to facilitate a safe and effective work environment that embraces both efficiency and professional accountability amongst all the staff members. And we're in the collaboration with the manager, I ensure and monitor the quality of patient care and professional standards of practice. A unique aspect of the NRT is that the staff work in multiple areas, sometimes different areas in one day. And so for that staff to be successful, they need to be adaptable and flexible to successfully integrate into the multiple teams. This in turn provides me the opportunity to interact with the staff on numerous floors throughout the hospital and to provide any support that is required.
Awesome. They predicted what, 10, 15 years ago that we're going to have the nursing shortage, which I think is kind of happening right now. So I think this is a super huge role just with the new staff coming on, because we have new staff everywhere, and it's good to have you being able to go around making sure everybody's okay.
Absolutely.
Yeah. So what aspects of the practice coordinator position give you your most job satisfaction?
I really enjoy the face-to-face interactions with the NRT staff during my daily rounds. I take pleasure assisting the new hires and teaching them about the hospital and discussing the different opportunities that are available to them. Many of the NRT staff are just starting their careers, so I endeavor to build a good working relationship with them so that they feel comfortable coming to me with any questions and issues. One of my nursing career goals has been to become a leader in the hospital, and this role has provided me that opportunity. I enjoy the challenge of this new position and being able to learn the new skills almost after 2 decades of bedside nursing, so this is really exciting to me. I tell our new grads that nursing is a lifelong learning opportunity, and I feel that I'm providing a great example for that.
Awesome. So what advice do you have for these new nursing graduates? Do you have for them to be successful in transitioning from student where, you know, you think you know everything, and then you go onto the floor and you're on your own, and then now you know nothing? That's usually how they feel. What advice do you have for them?
Yeah, I always tell our new grads not to be too hard on themselves when they're starting their career. We all started off as new learners, and it's so important to remind them that no one is expecting them to know everything. This is the time to learn and ask questions and take every opportunity to try skills and develop their own day-to-day practices. I also stress the importance of staying as informed and up to date about new policies and procedures in the hospital as much as possible. Healthcare is ever evolving, especially as we've seen with this global pandemic, and it is important to change with it. In order to stay safe and provide our patients with the most quality care possible, nurses must stay current in their understanding of the organization and the professional expectations. I do remind our new grads, we are here for the patients and to provide them the best and safest care possible. I believe that treating all patients how we would want our family to be treated is the key to providing that great care. Nursing is one of the most demanding, but also one of the most rewarding careers one can choose. It is important to keep our ultimate goal, providing safe, quality care in mind during all of our interactions.
Awesome.
Yeah, thank you.
Thanks.
Well, thanks again, Christy, for joining us today. We'll move on to our third panelist, so Kevin Halabecki. So Kevin, thanks short notice for filling in today. So Kevin is the clinical nurse specialist for critical care and neurosurgical services. So I think he has potentially the longest title in the hospital. So Kevin, thanks again for joining us.
Thanks for having me.
So Kevin, the clinical nurse specialist, or CNS as it's also known, is one of 2 advanced practice roles in Canada for nursing. The other one is that we're quite familiar with is a nurse practitioner. Can you tell us how the CNS is different from a nurse practitioner and a little bit more about the role of the CNS?
Sure. So a CNS is a registered nurse who has a graduate level nursing degree with in-depth specialized clinical nursing knowledge and expertise. And as the CNS, we build on our clinical expertise in our specialty areas that we're assigned to become content experts and change agents, integrating research, education, leadership, and collaboration. We act as resources for our colleagues on the nursing units, providing evidence-informed practice changes to benefit patient outcomes. A nurse practitioner, in contrast, has the legislative authority, knowledge, and skills to diagnose, order, interpret tests, prescribe treatments, and perform procedures. The role of the CNS includes more of care and management of complex populations, education and support of interdisciplinary staff, and the facilitation of change and innovation within the healthcare system. And the Canadian Nurses Association has a core competency list that helps support the role of the CNS. So that's a really helpful piece there too. And as a CNS, I use my knowledge, skills, judgment, and personal attributes to help drive change in my unit and the system.
That's great. So that's great. So Kevin, one of the responsibilities that you mentioned was that you are responsible for change or a change agent. So in your role, how have you supported staff during the COVID-19 pandemic?
So as a change agent, I assisted to develop the protected code blue process that ensured staff were protected from harm when performing aerosol generating medical procedures. Following Public Health Ontario, World Health Organization guidelines, we developed practices to ensure staff remain safe when caring for patients who were COVID positive and worked with the other CNSs and the Interprofessional Education Department to create processes for transporting patients throughout the hospital. The CNS role works collaboratively with the IPE department to ensure staff are aware of practice changes and that new information that's being passed on by IMT throughout the pandemic is being shared with all the staff.
Good. So Kevin, the CNS role is unique because in Canada, there is no course that you can take to become a clinical nurse specialist. So how did you make the transition from a frontline nurse in the ICU to the clinical nurse specialist role?
Sure. So before beginning the role as a CNS, I had just begun my master's in nursing. And it was definitely a change to transition from a competent frontline ICU nurse to the role of a novice CNS. Thankfully, we have a process in place at the hospital that a new CNS is paired up with a preceptor who acts as a resource to facilitate the learning of the organizational structure, learning roles of key contacts in the hospital, and acting as like a sounding board as we're learning to understand the culture of the organization, working relationships, and the approaches to difficult situations in our new role. And continuing education is really important as a CNS. We are expected to be up to date with current research and be aware of new practices throughout Canada. We're also asked to take our CNA certification in the specialty we're working in, as we are looked upon as content experts. And certified nurses are recognized nationally for their practice excellence and commitment to lifelong learning. And certification demonstrates specialized knowledge and brings many benefits to the organizations. A nurse with a master's degree also has a thorough grounding in theoretical foundation of nursing, and we can promote nursing research, generate new knowledge, and use our academic preparation to help mobilize skills and interpret and incorporate new knowledge into our practice.
That's great. So Kevin, what in your role gives you the most satisfaction?
So the most satisfaction, I'm able to help apply evidence-informed practice changes in the ICU, ensuring that the most current practices are being implemented and allow for the nurses to care for their patients with the best resources and knowledge available. This allows me to see that what I'm doing behind the scenes is allowing my colleagues to advance their practice and promote positive outcomes for our patients. Without the research and evidence-informed changes, it would be very difficult for our practice to improve and prevent our nurses from expanding their knowledge, skill, and judgment to care for patients in our hospital. Seeing my colleagues safe and engaged in education opportunity gives me the most satisfaction. Seeing nurses take advantage of the resources and opportunities to advance their skills make it feel like I'm doing my job well and helping create a safe environment for our patients.
Awesome. Thanks so much, Kevin. Happy Nurses Week as well to the CNS group. And you guys work very hard. I see Pete down here all constantly going through policies and stuff to make things better for the front side or the front line nurses, and it's awesome. So thank you for that. So lastly, the last person we have on our panel is, and I'm going to have to get this for Dr. Rhonda Crocker-Ellicott, President and CEO of Thunder Bay Regional Health Sciences Center and CEO of the Health Research Institute. So, but before I ask her a few things, just if anybody, just put it out there, if anybody has questions for any of our panelists, please just type them on the side, the question and the Q&A there on the side, and we'll get to those after Rhonda's done her little bit. I see there's none yet, so I want some questions put on there by the end of this little interview. So, is Ron, like I don't see her on here, so is she on?
I'm here.
Yeah, okay, perfect. Okay, so first thing, briefly tell us about why you decided to become a nurse and tell us about your very first clinical position.
So actually it was interesting, Dawn. That's a tough question. I don't know if everyone knows they want to become a nurse when they go into nursing school. And I reflect back on my career progression, and I honestly didn't know I wanted to become a nurse. I was one of those youngsters that went in and did career counseling and aptitude testing to try to find out where I somewhat belong. It was a combination between, do you want to be in healthcare, law, or agriculture? Well, I crossed agriculture off the list real early, and I still am interested a little in law, but I really was interested in biology and chemistry, and had really good relationships with my elderly grandparents, and was particularly interested in geriatrics, and took a keen interest in the health of my Baba grandma at the time, and so decided to pursue a career in nursing. My first position, my first position when I was a student, I actually worked as a unregulated RPN back in the day at St. Joe's Hospital, working in the emerge and doing float on the night shift. That was probably one of the best experiences you can get as a student. If there's any students listening, amazing work. Just, you know, I learned so much and developed wonderful relationships with so many that would go on to be mentors later in my career. But my first real job as a registered nurse was actually on third floor surgery at Port Arthur General. And it was a wonderful experience, but I can tell you times in nursing have changed because when I graduated, 6 months after graduating, I was laid off. I don't know if people remember the 90s, probably not a lot, but in the early 90s, there was actually a surplus of nurses. So many nurses went south of the border to find themselves employment. I was fortunate enough to find a full-time job in surgery. 6 months later, was laid off, and then took a position as a float nurse, which was one of the best experiences I ever had. So I had the opportunity to be trained in medicine, with surgery, as well as oncology and pediatrics. And I have some wonderful experiences that I learned through there that have sort of taken me in different areas of my career in life. And actually that pushed me to move on and register to do my master's in nursing. So sometimes out of some challenge in your career comes some good, but those were my first early encounters in nursing.
Awesome. I'm going to say, honestly, because I went to high school with Rhonda, so I don't know if I really would have thought that I would be bedside nursing and then Rhonda would be the CEO. Because back in the day, Rhonda, and don't get mad, she was Miss Teen Thunder Bay, people. Miss Teen Thunder Bay in grade 10. It was so good, so good. Okay, so my next question for you. So what made you decide to make the transition from bedside clinical to like a formal leadership role? Like, was there anybody that kind of helped you, that you looked up to, any mentors, anything like that, that helped you make that transition?
No, thanks, Dawn. I actually had to, reflecting on this, one of my positions before I moved into a formal administrative job was actually that of a CNS. So Kevin, I appreciate your comments. Worked as a clinical nurse specialist in the geriatric assessment program at Westmount Hospital. And part of that role was not only the hands-on, but it was also the developing of the program, because it was a brand new role. And so you're dabbling already in administration while you have the opportunity to work in research, education, and practice. So that was interesting. So I don't know that I really thought of myself as being in administration, but I did have the opportunity to dabble somewhat. But in terms of what made me make the decision, I actually don't think I made it. It was almost one of those things where you take a risk and take an opportunity, and things happen for interesting reasons. So if we think back to when the hospitals were amalgamating back in the early 90s, and we think back to, we had a new CEO in Gaston Levac, and we were building a team. I had a fortunate opportunity to be a part of the team then, and if you recall, postings were all internal, so it was opportunistic in some way. Took an opportunity to want to have the CEO know my name because I wanted to have future opportunities. And, you know, for whatever reason, I was very fortunate. I had my master's then. I had a lot of clinical experience, not a whole lot of clinical experience, but some, and I had an amazing mentor. So I think when you think about it, those of you who know Elsie de Blasio, who was the previous vice president nursing at Port Arthur General, amazing lady, incredible mentor. She took me under her wing, supported me through the entire process, supported me for many months moving into the role, and then I had an amazing team. I think back to the likes of, do you remember Joanne St. Germain, in Director of Surgery, Anne Ross, Director of Women's and Children's, Bev Junela, the Director of the Lab. There's so many amazing women and men that influenced and supported me in early days. and just you can't underestimate the value of mentors, leaders, and team members that really help lift individuals up and move them forward. Success is not something that you can do on your own.
Exactly. So what would you say is the biggest change you have seen in the nursing profession since when you first started your career?
It's an interesting question. When you think about some of that, I think there's two pieces that come to mind for me, and one is technology. You know, when it comes to things like as simple as IV pumps, I don't know that in the beginning of my career I ever used an IV pump. It was everything was run without a pump. I think IV pumps were something that were held for emergencies or intensive care settings. So, you know, you're running everything on your own. We didn't have bladder scanners or telehome monitoring, so the technology aspect of care has just transitioned so much. In fact, I was just thinking, you know, who wants to have me work with them for 4 hours one morning? I'm happy to come. I want to learn more about some of the technology aspects, but I think technology is one of those major pieces that has changed for nurses. And the other piece is really around role and scope and practice roles. So it was really interesting to hear from Michelle and Kirsty and Kevin and really hear about what are all the different things that nurses are doing. So we've seen role scope changes in terms of scope of practice for our PNs in particular, and now new and emerging advanced practice roles in so many different areas. And it's really taught me that nursing is so foundational for so much that happens in healthcare, and there's so many opportunities for nurses in so many different places. So this is just really an incredible opportunity for many people in your organization to hear about those opportunities.
And it has even changed like, it's crazy from the time I started as well. Being frontline right till now, it's insane how much we've changed just in basic, like everything. People are living longer, so they're like, we can keep people alive a lot faster. Dialysis, everything has really changed in upcoming. So, but I want to say, anytime you want to come down here and put some scrubs on, Rhonda, I will put you with somebody who will completely show you a really fun experience down here. So anytime.
I'll take you up on that, Dawn.
Okay. So the last question we have for you is, what advice do you have for staff who are interested in pursuing a position in leadership, especially in our corporation?
Yeah, thanks for that. So I think my advice would be, it will never feel like it's the right time. And you will never truly feel ready. But that said, take the opportunity to get a mentor, someone that you trust and can work well with, help, and you can share your goals with, you can share your aspirations with. Take the opportunity to get as much training and education as you possibly can in your areas of interest, and really try to pursue your passion. There's so many opportunities. I know everyone hears the old adage, you know, basically you need to take the risk, and until you need to continue to dream big and dare to fail. But there's a lot of truth in that. Any opportunities I've ever taken in life, I've never felt ready. I've never felt it's the best time. And at the end of the day, you know, it's so nice to be able to look forward and look at the future and have the opportunity to really take and shape what your future looks like. So, you know, anyone who's interested in chatting with me, I'm more than happy to chat with anyone about opportunities in leadership, opportunities in nursing, or just general support. But I think the big advice pieces would be the mentor piece, the training and education piece, and just not to be afraid and to really pursue your passion. Because, you know, the opportunity is now, there's so many opportunities. Unlike in the early 90s when we had a surplus of nurses, now we have a deficit of nurses, and we really need nurses to step up and step out of their comfort zone sometimes and take on new opportunities that'll really help us to create the best future within our organization for the next.
Great advice. Chad, am I doing this, or you're, sorry, we didn't plan after this part, I don't think.
I guess we didn't think there was going to be any questions.
Yeah, like I was kind of hoping there would be. There doesn't seem to be any questions.
No, there's actually 2 questions. So again,
Okay.
I want to thank Matt, and I want to also thank Christy, Michelle, Kevin, and Rhonda again for participating, and then also Dawn for joining and help facilitating the session today. So we have so far 2 questions. So the first one has quite a few parts. So the first one, and I'll just kind of open it up to everyone to whoever wants to answer some of the parts to the question. So other than the CNS position, what other leadership positions require a master's degree? Does it have to be a master's in nursing? And then maybe just elaborate about assistance that the hospital provides to staff for this education. So take it away, panelists, by answering that question.
I can answer the second half of that question. So
Sure.
the assistance that the hospital provides is annually they have that tuition reimbursement that you apply for every February, and depending on how many people apply will depend on how much is issued back to you, but that helps towards tuition, towards schooling, or towards certifications or any conferences and stuff that you would attend.
Plus the RNAO, I think also.
Yes.
You can also apply for reimbursement with RNAO.
So go ahead, Kevin, please.
I was going to say one of the other leadership positions would be a nurse practitioner. They require their master's with their program as well. But sorry, go ahead, Rhonda.
I'm just going to say there's various different streams of what roles would require a master's, which roles would be advantageous to have a master's. So sometimes there's roles that it would be preferable to have a master's degree, and sometimes the preference for that degree could be in clinical practice, and sometimes it could be in business, depending on which sort of arm of nursing that you're looking to advance yourself in. So when it's the bedside, the CNS or the nurse practitioner or other highly specialized clinical roles, it's that master's in nursing, or as Kevin spoke to, the other qualifications. And then if it's a leadership position that may be a manager, a director, or another individual in that arm, it may be a master's in business or something like that. But we've been pretty flexible, I think, in our organization to recognize that individuals take many different career paths to get to various destinations. And I honestly believe that no education is gone wasted. And I mean, I've taken an interesting career path. I did my master's as a clinical nurse specialist, so I didn't have a core business background initially. I did that later on after that. But certainly, I think there's so many different opportunities, and I'm always a strong proponent of education of any kind.
Great. And then maybe, Christy, this might be directed more towards you. And the question is, what are new nurses expressing interest in within the nursing profession?
Well, I know the nurses that I've been working with the spring hire, I think they're just all so new right now. I think they don't really know what part of nursing they want to get into. So that's why I'm really trying to promote that, you get your basis down and you figure out where you want to work, whether it's medical, surgical, or specialty areas, and then you get the education for that, and then you can move on with the different opportunities. So right now it seems to be a lot of, bedside, and then they just have to determine if they want the medical or surgical or ER or IC or any specialty area.
Yeah, and it's obviously so many different avenues that they have.
So many.
They can try out, right?
Yeah.
As clearly describing here today. So what about master's prep? And this might be, again, go more towards Rhonda, but what about master's prep? Do you think it says here for managers? Should this be a standard?
I mean, that's hard to say. I think right now the general requirement is that you have your registered nursing degree. So all nurses now are prepared at the degree level, and that's certainly I think a great qualification for a manager. I think there's always opportunities if you're aspiring to do more and different. And so if you're aspiring to do more and different, then of course a master's preparation is always something that will be a positive piece to pursue and attain. And I think it's an individual piece. And certainly we as an organization can also do more to help support managers with the specific skills and needs that they have to do in to be able to be more proficient in their role. And sometimes that comes from formal education, and sometimes that comes from organizational training that we provide. So I think I don't think it's an absolute requirement. I think it's a nice to have, but I think we have a responsibility to support those that are interested in pursuing master's preparation.
Great. And then I'm not sure what kind of input we might have for this question, but is there any news on the Nursing Council as an opportunity for frontline staff to explore nursing leadership? The only thing I know is that it is being worked on and that it's coming soon. So obviously stay tuned for more information. And Megan is texting saying it's coming soon. I guess stay tuned for more information. If obviously anyone has any insight to that, let us know. And then let me just check here if there's any other questions. I don't see anything, and not missing anything, Don, I don't think.
No, I don't think so.
The only one thing, I just see one of the comments about the frontline staff exploring nursing leadership. For the staff that are interested in it, take advantage of being a leader on your unit, like be a mentor, take the training that you can do for mentorship and preceptoring so that you can show that you have that interest. If there's any practice changes, talk with your CNS and be a practice champion. Things like that. Get yourself involved in your unit so that you can start gaining that leadership skill.
Good advice.
Okay, and Megan, we got a question here again for our panelists. If you had one wish for nursing, what would it be? Michelle wants a webcam.
Yeah, a webcam would be nice. I think my wish for nursing would be, number one, more nurses. You know, as Rhonda had pointed out, you know, years ago we had an influx of nurses, and a lot of us are getting to that age where we will probably be retiring within the next couple of years. And, you know, we're already encountering shortages, so it would be nice if there were more staff out there.
Anyone else? Christy,
Sure.
what's your wish?
Well, go ahead, Chrissy.
Oh, I was going to say, if I can say any wish for nursing, I'd be like not to see another global pandemic.
I'd say unlimited education funding so that staff can advance their practice as much as they want it.
Good one. Good one.
And I wish that that nurses would recognize how critically important they are to our care, and that they would recognize how much they're valued and appreciated in the course of care, and that the human touch is just so important. And just a huge thank you to everything that all of our nurses do every single day, including Nursing Week, but and how much of a difference you've all made in helping us to really rise to the challenge through the last 14 months.
Excellent. So again, thanks. I don't see any more questions coming in. So I think that, again, just thanks for everyone for joining us today. The participants on our panel, as well as the people that joined in on our virtual Q&A session. So again, thanks Don, Kevin, Christy, Michelle, Rhonda, and then also Matt for joining us. So again, thank you. Take care. Have a great remainder of your nursing week, and all the best.
Have a good weekend.
Thank you.
Thanks, Chad.
Thank you.
Thanks, Don.
Thanks.
Bye.